Hi everyone, as you have seen from our previous trainings, you have seen that Marvin Manor needs uh, to adopt electronic healthcare records. So to adopt these electronic health records, as the staff, we need to know what are the benefits of electronic health records and how we can use it as the whole staff, either clinical staff or managerial or administrative staff. So let's first see what is electronic health records. Electronic health records are computer systems that integrate different clinical practices to ensure the best healthcare services are given to our patients. Some of those clinical practices, their treatment plan, their scheduling, appointments, calendars, and some functions that deal with billing and other payment things using computer systems. So when healthcare center organization uses electronic health records, the whole staff remains on the same page, either the clinical staff or the managerial staff. So they exchange uh, something, updates or patient information so that they can serve very well the patients. So after we have seen what is electronic health records and how it helps our different healthcare organization and how it will help our Marvin Manor nursing home, let's see different components that electronic health records use to support especially clinical care and different relationship between the patients and then the physicians or the care providers. In the first practice that electronic health records use in direct clinical care, there is the procedure that patients go through when they go to meet their provider. So let's take an example. The patient comes at our nursing home. He or she wants to meet the primary care provider. So when a certain health care center uses the electronic health records, for that time the patient have different procedures with the people using paper-based system. When a healthcare center uses the electronic health record, the patient sees first the medical assistant before meeting the primary health care provider. So when the patient meets the medical assistant, so the medical assistant takes some like test some signs, ask the patient what is the primary goal of the visit and what is the really first thing that the patient needs to ask or why she or he needs to meet the primary provider. After doing that, the medical assistant checks on the patient what could be the allergies on specific medication, what could be the best or suitable medication and practices to perform on that patient so that he or she can receive the best care she or he needs at our nursing home. So when we use electronic health records, there is a computer at the exam room where the patient meets the medical assistant, examine the vital signs, see what are the allergies and what are the specific procedures and medications the patient can have. After doing all those procedures, the electronic health records notifies the physician or the care provider that the patient is ready to be seen, and the medical assistant leaves the room and then the physician enters into the room. So there comes the second practice where electronic health records brings in is an important role. So when a healthcare provider uses electronic health records, so that provider, there is a specific procedures he or she undergo when examining and prescribing medications to the patient. That time, all the provider first have seen the information and everything on the patient through the health records on the computer, and then he comes in the room where he knows where to start. They don't take much time talking about the history, talking about the allergies and everything. The provider comes in when they need to discuss what is the actual issue and how he or she can prescribe the appropriate medicine and exams or tests to the patient. So when the healthcare provider prescribe anything, could be a medication or a test, the appropriate people sees it on their computers, because when you use electronic health records, everyone, as I've said, is on the same page. Could be laboratorians, pharmacists, everyone can see the patient's information on on a computer, sorry, and see what the patient needs so that he or she can receive the appropriate care. So you can see that the two components, the first meeting the medical assistant, in the procedure that the care provider undergo when he or she examines and prescribe uh, medication or test, it's really a good, easy, effective, and efficient way when the healthcare center is using electronic health records. So let's see how electronic health records helps in the administrative or managerial processes. So when the patient needs to meet the care provider, you know that when they use paper records or patient charts, the patient come on the front desk, see what is the the free spot, who is the free physician, and they schedule the appointment on that time. Sometimes the patient have to go back. So but when we introduce electronic health records, patients will be able to schedule appointments and give their history information. What is the previous information from medical visits on a computer when they're at home, when they're at work. So when for example, I could be at home at night and I want an appointment in the morning or the next week, so I don't have to come to the nursing home. When the nursing home has the electronic health records, I share the information with my care provider and the medical assistant and everyone on the center to see what I need. I schedule an appointment where I see there is a free spot, schedule with the physician I want, and agree on the time I will be coming. This is a good thing because it's not time consuming. The patient comes when he or she knew very well who he or she is meeting, why, and have updated the physician the previous medical visits, and they meet when everyone is on the same page. So the second very good thing uh, when a healthcare center uses electronic health records is that the managerial aspect is very easy for them for the payment or billing on the services provided to the patient. So when a healthcare center uses paper records and everything like that, patients, after doing all the services, they go to the front desk, go on the process of billing each service, and then they pay their payment and check the insurance package and everything. But when a healthcare center has electronic health records, patients go on the front desk or waiting room, there's a computer there, they write their information, they write their insurance package, and there comes the insurance eligibility, what are the money the patient has to pay before meeting the physician, before performing the tests. That time the patient knows how much to pay. Patients can pay online or they can pay on the front desk when they know that, when they want that. So that is easy for the patients because it's not time consuming for them, and they can really know what is going on. So here the check-ins are very quick because they go on the computer, fill everything, and then after filling everything, they are being notified on their insurance eligibility, and they pay everything and know and go in the medical visits as usual to the provider or the medical assistant when everything is covered. So here some patient may wonder, why do I have my information online, everything about privacy and everything? But here the medical center or nursing home has to explain to the patients the benefits and how successful electronic health records will help them to receive the best care. That time patients cannot deny using it. So it's our responsibility, after understanding all these benefits, to us providers and to our patients and clients, to explain to them how introducing electronic health records will help us in providing and giving them the best care that they need. So after that, we have seen that there are different components of electronic health records, both to administrative and to the clinical care. So when there's an integration or combination of those all benefits and everything, uh, both administrative and clinical care staff works together, be on the same page, and they provide the best care needed to the clients or to the patients. For us in our nursing home, when we work together, both administrative and clinical care staff, we will provide an improved care to our patients. We have a teamwork spirit, and we will share information of our patients and give what is suitable, what is good to our clients, than giving them what we think that is suitable to them. So thank you very much for coming for this briefing. I think from the previous training in this briefing, you have understood how it's really important to introduce electronic health records. So we need to switch from papers records to electronic health records, and I promise you that we will have the perfect care in our nursing home than before. Thank you very much for coming.